Hi, Mandy and Chelsea, and welcome to the Mama Village.
Hello.
Hey, Ellen.
I'm super excited to have you both on here. So, we have a bit of a history. You are two osteopaths, and we're going to talk all about your osteopathy care, particularly for preconception, pregnancy, and postpartum for women. But we're friends outside of this, and I came along to your beautiful retreat that you did in Bali recently, and we connected there. And ever since, we've been talking about coming on the podcast. So, I'm super excited to have you both on here today.
Thank you so much for having us. We're
We're
very
happy to be
excited.
here.
So, do you want to start by introducing yourself? So, where are you from and what do you do for a living? I mean, we talked a little bit about the osteopathy as well, but yeah, tell us about yourself.
Well, I'm Amanda. I'm an osteopath and the owner here at Osteos of Noosa. My hubby and I, we travelled around Australia for a couple of years, originally from Melbourne, and provided osteo around Australia and decided that beautiful Noosa was a wonderful place to set up and bring up some amazing osteos to come and work for us and help out the locals in the area.
Oh, I love that. And tell us about yourself, Chelsea.
And I'm Chelsea, so I'm an osteopath as well from Victoria. I moved up here to Noosa to work up here because there's a lot more osteo opportunities up here. There's not as many osteos as there are down in Victoria. So lots of work opportunities in Noosa and also in rural Queensland as well. So yeah.
Yeah, beautiful. And I know I'm biased, but Noosa is so nice and warm and sunny compared to Victoria. So,
Yeah.
I'm sure that was a bit of a motivation as well.
Yeah.
So, can you share a little bit about your background in osteopathy and what inspired you to pursue a career in osteopathy?
So I used to be a dancer, and with dancing comes like the beauty of strength, flexibility, balance, and also just like beautiful lines and functionality. So the biomechanics of that and just really increasing those beautiful lines and capacity of the body really drew me to osteo. And obviously with being like a quite high level dancer comes a lot of injuries. So that was definitely my driver for getting into this career. And I've also just always been quite entrepreneurial. So starting my business, I was really fortunate my husband's an osteo, so we've joined forces and done this together, and it's been awesome. Absolutely love what I do. I'm really lucky.
Oh, that's amazing. And if you don't mind me asking too, why osteopathy over, say, a more medicalized profession? Because you mentioned dancing and injuries and that sort of thing. Did you already have a bit of a holistic background?
Oh, I guess so. But for me, I just always really loved, I'm a very like tactile person too. So I love sort of problem solving and physically seeing results. So, I could have gone into more of the medical model in the way of like orthopedics or something like that. I was also really drawn to paramedics as well because I really love that sort of like adrenaline, on the spot. But I just found this is I really always liked the idea of private practice and just being one-on-one with people and being able to really empower and educate them and get them back to doing what they love.
Oh, I love that. And what about you, Chelsea?
I got into osteo. I was, just always interested in health and wellness and probably a bit more from that holistic lens. Like I did a few different sports, but I probably came into it from, I had a bit of an experience in that holistic health working with naturopaths on like skin and hormone health. So I actually was almost going to go down that path of dietitian or naturopath, but then I just didn't really want to be stuck behind a laptop and just sitting and talking to people. I found that with osteo, we could still treat holistically, but be a bit more hands-on in terms of what we actually do for work. So there's a bit of sitting, chatting at the computer, but there's also hands-on and working with the whole body, so I found that you could, attack that holistic lens a bit more than just one element. So then I looked into it. The question of why not other modalities as well. Like I looked into physio and chiro or all of those options as well, and just loved that osteo was more holistic, and came back to working with that whole person, whole body, and then fell in love with it and still are.
Ah, love that. So we spoke a little bit about different modalities and the medical sphere versus osteopathy being holistic. We alluded to that a bit. So do you want to explain what osteopathy is and how it differs from other forms of medical care or physical therapy?
Yeah, so for anyone out there who doesn't know what osteopathy is at all, it's a manual therapy. So much like chiro and physio and massage, everyone sort of struggles to distinguish what the difference is there. And look, every osteopath and every chiro and every physio is all very different. But generally, chiropractic is more based around the spinal alignment and neurological system, and physio is more based around musculature and rehabilitation. So osteo sort of encompasses both of them, I guess. We approach both of those systems and can assist with injuries in those areas. But like Chelsea said, the key word for an osteopath is holistic. So we do look at the whole body, and that's all those sort of tissues like muscles, bones, ligaments, tendons, but we also look into lifestyle factors, organ health, hormonal health, visceral, all of those things, and how the whole body is connected, and how not only we just treat, say, you've got a sore hamstring, it's why is that hamstring overloaded and repetitively tearing? Is it something else going on? Is it a previous injury impacting? Is it what you're doing in your daily life? So I love that it's just all problem solving. It's going, okay, this is what it is. Why? And it's bringing in all of those factors. So I guess that's the major difference between those other therapies. But we just like to think of the body as a self-healing and self-regulatory mechanism. So if we can get it back to normal or homeostasis or that equilibrium, the body can actually heal itself. So it's all about actually just getting the body back to normal so that you can function really well.
Yeah, optimal health we want to get to. Yeah.
I love that. And I love that it's a whole body approach as well. Like if you've got like you were saying, an injury or a tight hamstring or, a repeated injury even, you're looking at the whole body. Why is this injury still happening? What else in the body isn't quite in alignment, and what can we do to get everything to come together and heal itself? And I love that. So can you explain how osteopathy techniques work to promote overall health and wellness? You alluded it to a little bit just now, but can you expand on that a bit more?
Yeah. So the thing that I love about Osteo too is we have so many different techniques that we can do. So I find that sometimes people come in and they say, oh, I'm not really want to be cracked or something. And that's okay, because we don't have to use those sort of techniques. Like we can tailor the technique approach to every individual. I would never do the same treatment on one person in the same day or week, or it's always different. So I think in terms of like hands-on techniques that we can do, we have a whole range. So we do a lot of soft tissue, like myofascial release, trigger point release. We can do some HVLA, which is adjustments, or like the cracking techniques people might know of. We can do dry needling and cupping. So we have a whole range of our hands-on techniques, but then there's also education, there's also rehab or lifestyle advice. So even if someone isn't that keen on a really firm hands-on treatment, there's a lot of other stuff we can do to promote healing and well-being in the tissues of the body. So there's lots that we can do.
Yeah, it sounds like you just have like such a vast variety of different treatments.
Yeah.
Like you can do cupping, you can do the dry needling, you can do even massage. Like there's so many options, and I love that as well.
Yeah.
So what are some of the common misconceptions about osteopathy, and how do you address these?
I guess, people sometimes they'll come in and think we're limited to what we can do. So they're maybe not aware of what we can do. So the scale of things that we can do. So they might come in and be like, oh, I'm not sure if you can treat this, maybe something like a migraine, or some people don't realize we can treat the feet. I think they need to go to a podiatrist for that, but the feet might be really important into what's happening up the body as well. So that's probably, some misconceptions of what we can do. And even if they don't want to be hands-on, like there's still a lot of education and things that we can support them with. So I feel like any patient, it's a good start to come and see us. Even if we feel like we can't help you, we will help you find someone that can help you. So those referral networks are really important as well.
Yeah, I love that. So it sounds like you're getting into a little bit of the complementary therapies, which we can talk about a bit later as well. But in saying that too, I still feel like there's something that you can do. Like there's always a way that you can help and the body heal together, and then perhaps you could refer someone on if you think they need additional treatment.
Yeah.
But because you have so many different techniques and it's a whole body approach, I feel like there is always a treatment that you can offer that will assist in that healing process.
Yeah,
Definitely.
And I guess too, like some patients will come in if they have an acute injury, but we also treat a lot that more of that maintenance, people wanting that just overall optimal health. So we encourage a lot of patients to continue seeking treatment, whether it's like monthly or 6 weekly or something, to just prevent injuries as well. That's a huge part of our job, and something we're passionate about, so that we're not getting to the point where we're in really acute pain,
hobbling into the clinic.
Yeah. Yep, like me. Mandy has treated me before and I was that patient. So I love this prevention aspect of it as well, because I am all about prevention, especially in the pregnancy, birth and postpartum space, which we'll get into soon. But the key is prevention. So I love that you've said that. So, and on that too, what led you into discovering your niche within osteopathy? So, specifically working with women during pregnancy and postpartum.
So for me, it's always been an interest. I mean, I've got lots of nieces and nephews and friends with babies. So I've always been around it, and I always really love empowering women around that area. And I've also just had a bubba myself. Actually, I can't say just anymore. He's 11 months. He's almost
It still
one.
counts.
So obviously going through that whole journey myself recently has really sparked it for me particularly. So that's really driven me to do even more study in the area and help other women, and particularly in this area being a small town. You forget that Noosa is a small town. There's not many services up here. So it's really, really awesome to be able to help those women up here who don't have much access to those services, and yeah, not only help them through the area, but also just relate and empower and chat to them about it. It's fun.
Yeah. And doesn't it just give you that deeper level of understanding too, now that you've had that little bub? And it just, I feel like it just makes your interest even grow. And I love that.
Definitely.
And what about you, Chelsea? What sparked your interest in this area?
Yeah, I mean, just from, I guess, my love of health and stuff that I've gone through, just always interested in women's health and just probably realized that there's a lack of support and treatment options for women. Really love that aspect of educating and empowering women to feel confident in themselves, because I just realized so many patients coming through pregnancy and they weren't educated and they didn't really understand what was going on in their body, and that can lead to just feeling so disconnected from themselves through that experience. So I think it's really important, but I also enjoy treating not just pregnancy but also like other females with period pain or endometriosis pain, assisting them through that as well, which is supporting them, even pre-pregnancy if they decide to have kids one day, through that whole experience, postpartum into menopause. Yeah, there's just a need for that sort of support in our healthcare system. Yeah.
Oh, totally. Totally. Like, come on, everyone. We need more of this. Seriously. For too long, we've not been seeking the services we need. And when I say we, I mean women in general. We have very busy lifestyles, a lot of stress. We
Yeah.
don't have that village community around us anymore. And
Yeah.
that wise women knowledge is disappearing, which is really sad. I think it's coming back though. I think it is.
Yeah.
But there's that real need for women-centered care.
Yeah, and on that too, I think it is an exciting time for women's health. I think, like with a few courses and webinars and things I've been doing recently, there is good research and evidence coming through now with these sorts of women's health conditions and experiences. So, like, it's an exciting time to be working in this space, because there's a lot of exciting research and stuff coming through. And
Yeah.
yeah.
So, how can osteopathy support individuals during the preconception phase? So, when we're trying for a baby, and what specific treatments do you focus on in that phase?
Yeah, so I mean, a bit like what I touched on before, like we're wanting to support women through their whole experience. So, whether it is they've got dealing with some period pain issues or hip pain, back pain, any of that, we want to start with an optimal environment before we even go through the marathon of pregnancy and birth and postpartum, all of that. So, preconception phase, like if I have a patient that's wanting to get pregnant in the near future, we're going to be working on their pelvic health, any asymmetries or imbalances through the body, so that they're, feeling good. Pain can lead to all sorts of, different imbalances, and may not, if they're in pain, they may not be sleeping well. Their hormone health isn't going to be optimal. So if we can get them out of pain and moving well and feeling good, that's going to help them, give them the best chance through the preconception phase. I also really like to work on imbalances through the body to prevent then pain or complications coming up through their pregnancy. So if we're feeling good and moving well before we're pregnant, there's going to be a less likely chance that they're going to end up with pelvic pain and back pain through their pregnancy as well. And then also just education. So talking about stress management and even just getting them to start feeling more aware in their bodies, I think is really important before they head into that journey. Yeah,
So
that comes in.
another thing also I sort of wanted to touch on here with preconception phase is a lot of women, particularly if they're sort of struggling to get pregnant, it can be a lot of stress on them, but we've also got to remember that male health is really important as well. So even just having them comfortable to talk to their partner or being aware of that can be a massive thing as well, because that is another thing that can lead to stress and creates a different environment. And yeah, like that was something even in our journey. We weren't really getting pregnant as quickly as we hoped. And Chris actually went to see a naturopath and he got on top of his spermal health and bingo bango, we got pregnant.
Oh, wow. I love that. Again, it adds to that deeper understanding though, right? Like, you know now that you need to be looking, I mean, I'm sure you knew it before too, but looking at the male and the female in heterosexual relationships anyway. So yeah, super important.
And even on the side of not even spermal health, but even he was doing a lot of training for his triathlon. He was on his bike a lot. So even males' pelvic floor, prostate health, all of that can have a big impact on sperm count and everything too.
Yeah, wow. I didn't realize.
Yeah.
I didn't realize osteopathy was so extensive. Like it really, like you can help with things like that. And I think that's great. So are there any specific techniques or lifestyle recommendations that you would suggest to optimize your health in that preconception phase and prepare the body for pregnancy?
Yeah, so sort of like what Chelsea said, a lot of it's prevention. So that's so unique to who's in front of you. Like it's really easy to say, oh, we do this stretch and give them this exercise, but it really is individualized to what the client is coming in with, their history, any aches or pains or injuries or surgeries or previous babies, anything that they've had. But there are definitely some things we can do to help with decreasing stress, decreasing pain, like we're sort of touching on with those hormonal and infertility things, whether it's us or referrals. It's a really good place to start to know sort of where to go. But we find even just advising on sort of diet, decreasing environmental toxins, exercise, those sort of things can be really important too. Whilst we're not, specialists in those areas, we do have an understanding of that and can really paint a good picture of maybe where you do need a little bit of assistance. But yeah, we've got a couple of techniques and things that we go to, particularly for increasing mobility through the spine and the pelvis and decreasing stress, improving people's sleep position, ergonomics, all of those sort of things too.
Yeah, amazing. And I guess on that too, for women who are experiencing infertility and perhaps they're going through some IVF or other reproductive technology assistance in the preconception phase, osteopathy, I imagine, could be a complementary therapy to that as well, for all the reasons that you just mentioned.
Yeah. You think about sort of stress in the pelvic floor being tight, even if you're doing regular injections, all of that fascia that wraps around our organs and our tummy and all the nerves, vessels, everything like that. If that's all tension, tight, dehydrated, not elastic, all of that can have a really big impact. So there's a lot we can even do around the abdomen and the uterus and its connection to the pelvis, and that all relates to what you're doing on a daily basis. And yeah, so it's a really amazing job in that sense that it is a puzzle, and it's really fun to unwind it and give people some things that maybe they didn't realize could have been contributing.
Yeah, even a lot of women have work stress and stuff. So many have hold stress either around the pelvis or shoulders, jaw, and even like a little fun fact that the jaw is really closely related to the pelvis as well. So like if you're a jaw clencher or grind your teeth or that sort of thing, we can have tightness through their stress, and then that can lead to tightness through the pelvic floor and stuff as well. They sort of work together.
Yeah, isn't it amazing?
Optimally, yeah.
And I guess even with back to the misconception part as well, I think there's this perception that if you're going down the medicalized route that you can't use holistic therapies. And it's just so that that's so not true. They can complement one another.
Yeah.
And they can work together. Yeah.
And what's the loss? Honestly, going and seeing an osteo, you don't know what they're going to pick up on or how or like you're saying, a lot of people don't know how we can help, but why not? Why not get an extra opinion? We're all very good at being like, oh, I went to one person, whether it's an osteo or a doctor or a naturopath. Why not get another option, another opinion? Because I'm sure we've all experienced where you go and see someone and you're like, oh, why didn't I do this sooner?
Yeah, totally. So moving on to pregnancy and preparation for birth, at what stage in pregnancy do you recommend women see an osteopath?
Any stage. The earlier the better, but better late than never.
Yeah.
So yeah, any stage, I'm seeing clients pre-pregnancy, thinking about being pregnant, getting pregnant soon, and then someone who I've had someone the other day that just found out they were pregnant the day before and they came in, or 7 weeks or anywhere in that first trimester, and then we get some coming in maybe later stage if they haven't heard of osteo, and quite often they'll have a friend say, oh, go see your osteo in like towards the end of trimester 3 as well. So anytime we can do different things throughout each phase as well. So even if you're not really feeling up to a lot of hands-on treatment, there's still education or some really light hands-on techniques that we can do as well. So any stage.
Yeah, love that, because I think for a lot of therapies that are out there, I don't know if it's a fear or just a recommendation that women don't utilize those therapies in the first trimester of pregnancy. So I love that with osteopathy, you can still utilize that therapy in the first trimester. It's completely safe from what you've said. And there's absolutely things that you can do to help women in those early stages of pregnancy.
Yeah. And I guess safety too. Like there's certain techniques that we wouldn't do maybe in the first trimester when things are quite early. So we definitely take safety as a front of mind. And so yeah, there's things that we'll do at certain stages to ensure that safety throughout as well. Yeah.
So, are there any specific techniques that are particularly beneficial for pregnant women? And that could be in the early stages of pregnancy, second trimester, third trimester. Let's get into all of that.
So I guess it's so dependent, like I said before, on who's in front of you as to what techniques you're going to use at certain stages. The biggest thing being their history and any underlying conditions. So let's just say for this example, they've got a previous injury, whether it's almost like a common runner and they get hip pain, that can definitely get exacerbated throughout pregnancy as we get a lot of relaxin, our pelvis changes, we get spinal curves, gravity, center of gravity shifts. So those underlying conditions that might not even be sore at the moment tend to come back.
Yeah.
There's a whole range of new things that come with pregnancy as well. So we do find a lot of techniques around addressing the pelvis. So a lot of people tend to have sort of torsions through their pelvis, a more dominant side, and these can lead to injuries in pregnancy. Up through the rib cage, particularly like Chelsea was saying, a lot of women sitting at computers, if we're really stiff through that mid back or that thoracics, that can overload the lower back and that musculature can get really tight. And then as we sort of go into that further stage of pregnancy, as boobs get bigger, belly gets bigger, that change in spinal curve, that can just lead to a whole range of issues. So we do a lot of mobilization to joints to keep everything really nice and mobile so that we don't cause any sort of imbalances. We do a lot of release work through muscles, and we just allow the body to try and grow as baby grows, really. It's like trying to have a tree grow straight. You sort of like assist it to grow straight. So otherwise it sort of just goes off on its own. But I do like to use the analogy with women that pregnancy is a marathon in itself, but with like an event at the end, which is your birth, no matter what type of birth you have. And think about that lead up. You train, you eat well, you sleep, you don't drink, all these things. You take such good care of your body. So we need to do that throughout pregnancy as well. But
yeah, I mean, I guess like treatment wise, just a few key areas that we look at. Like I'm always looking at sort of ribs and diaphragm, like how we're breathing as well. Like you commonly hear that pregnant women feel like they're stuck and they can't breathe. So just allowing space there, and even just space, like giving some space through those lower ribs and pelvis, and we've got more room for the bum and belly to grow. So yeah, you'll feel sort of more comfortable, I guess, as you grow and move through, because we're assisting with those changes, throughout the journey.
Yeah, and I think I can relate to that too, particularly the shortness of breath, like not feeling I have enough space. And I know that my posture wasn't great throughout pregnancy. And I feel like if I had seen an osteo and received some release work, that would have just allowed my lungs to expand and lifted me up a bit more and allowed more space and room for the growing baby. So I love that you've mentioned that.
Yeah. And another thing too that people probably just think is normal. Oh yeah, it gets shortness of breath when you're pregnant, but it doesn't have to be. We can help with those things. Yeah.
It's probably my most hated phrase, I should say. It's normal.
Yeah.
I cannot stand how often we use that for pain or discomfort. That just simply isn't normal. Common, yes. Common, like that's fine. But I always feel like there's something that can be done. there's something that can help this and alleviate the pain or discomfort or nausea or whatever it might be. It might not eradicate it completely, but there are so many different things that you can do to help. So I love that you've said that.
Yeah. It's important.
And on that topic too, so can osteopathy help alleviate symptoms for things like pelvic girdle pain? I've had a few women on the podcast before that have complained about that a lot, or even sciatica. And you mentioned lower back pain as well. So how can osteopathy help with those sorts of things?
So that's our bread and butter when it comes to pregnancy. We see so much of that. So like you were saying, it's really common, but it doesn't mean that it's normal. And even things like lightning crotch and, that round ligament pain that you get, that sort of stabbing like a stitch. Again, all of that's really common. And you think, oh yeah, it's just that lightning crotch. But that is really just tight adductors trying to take the load of increased...
Yeah,
what am I trying to say? Thank you.
Yeah.
So even just release work through the adductors can literally help lightning crotch. Like super, super simple stuff.
Yeah.
But when it comes to pelvic girdle pain, I mean, think about you gain sort of up to what some people are 10 to 20 kilos. So imagine wearing like a front pack. When you travel around Asia and you got your front pack, that's massive. And you're carrying that around 24/7. So pelvic girdle pain is very common.
Yeah, even with pelvic girdle pain, we've got all of that load coming through. Like, we're carrying all those extra kilos, and we've also got like ligament laxity and hormonal changes. So all those ligaments around the pelvis are trying so hard to hold on, and then our muscles around it are going to be tight to help support the pelvis. So even just doing a few little releases around those muscles can really help to alleviate that. Even sometimes we start to get pain and then we feel like we need to really hold on to protect it as well, and sometimes that can make the pain worse. So again, an individual approach. No pelvic girdle pain is the same on every patient as well, so we take that into consideration with each patient and give them the right technique. We'll use different techniques on them, and then lifestyle and exercise advice as well.
Oh, I love that so much. And how can osteopathy treatments help prepare women for labour and birth? And are there any specific exercises that you recommend?
I feel like we could talk about this one for a long time. So I guess prepping for labour and birth, it's so different for every woman, and it so depends on what type of birth they would like to have. And we can help with any kind of birth. So don't feel like, oh, I'm having a cesarean, so I don't need to prep for labour. There is so much we can do, because it's not only the actual birth of your baby, it is also what your body's going to go through, the recovery, all of those things leading up to that. So your body's still going to get so much relaxing in that last stage of pregnancy. Regardless, you're going to be put in a position for a long time. Your body's going to be doing a lot of work regardless. So I guess maybe we'll sort of focus on a vaginal birth for this. But when you've got a baby coming through your pelvis, which is, again, one of the biggest things you'll go through, like that marathon, we want to make sure your body is so capable and ready for bub to come down. So even, for example, our hip flexors act like baby slides. So your baby literally slides along your hip flexors. Then we've got our pelvis, which is like a big bony bowl, and bub has to fit through that pelvic outlet there. So if you think about, you've got your sacrum, which is the big triangular bone at the base of your spine, and you've got your big pelvis that wraps around. We need to get bub through that space. So if you have any torsions going on or any restrictions through that sacrum, that can create a limitation. And then bub's going to try and get through a smaller space. So we really want to try and make sure all the joints through the pelvis are really mobile. We want to make sure everything can tilt forwards, backwards, side to side, rotate, and all those muscles are nice and relaxed so that we can stretch and get bub out. And that doesn't even come down to bones and muscles and tissues. It also comes down to even the skin and everything around the area where bub's cutting out. So we do a lot of work with perineal massage, working on any previous episiotomy scars. So there's so much in that. And even when it comes to you and your positioning and how your partner can help assist and everything like that as well to try and achieve your ideal birth. And then plus help after. So obviously after birth, it is such a big recovery regardless of how bub came out. So advice on various things there. Common things we often see is a lot of like coccyx pain, because people sit on their coccyx for a lot if they've had epidurals. Even post-cesarean, people get a lot of shooting pain around the abdomen. So we can do a lot of work through there to try and assist scar healing. There's so many things.
And even preparing for cesarean, making sure the skin and fascia and muscles that elastic. We can help with, promoting blood flow and
Mm.
everything through those muscle tissues so that it is elastic, so that, it's better chance of that healing process. So we can help with that pre and post as well in terms of healing through there.
And even if you have a cesarean, your pelvic floor, everyone goes, oh, my pelvic floor will be fine because I'm having an elective cesarean. But your pelvic floor has still undergone one of the biggest changes. It's had so much load through it for the last 6 months. And even though you're not planning on having a vaginal delivery, there is still a lot of things that can happen through that area. And people don't really realize until after they've had the cesarean that they actually get issues in that area. So you can still get urinary issues and things like that. So don't ever think just because you didn't have a vaginal birth that you don't, you can't have pelvic pain or pelvic floor issues, because it is, again, common, but not normal.
Yeah, totally. And even things like prolapse and stuff like that. I mean, a lot of women walk around with prolapse in pregnancy or after birth. And even if you're having a cesarean birth, you can still experience symptoms of prolapse throughout your pregnancy because of that load on your pelvic floor. So, like you were saying, it doesn't matter what sort of birth you envision. To see an osteopath, it would still be so beneficial to the woman in preparing for labor and birth. I would even say more so if you're going to have a cesarean or an instrumental delivery even, so forceps. Not that that's really planned for, but all of the treatments that you can offer as an osteopath would help with so many of these interventions that can happen in birth, not only for physiological labor and birth.
Yeah, again, it's like that prevention element. Like, I find even if I've got a pregnant patient come in the early stages, we're talking about preparing for birth of whatever they choose to do, like at those early stages, and we're assisting the body to move through those early stages. Like, if we can help the pelvis move better before there's that load of, a big tummy and a big baby in there, we can help with that load of mobility before we even get to couple of weeks out from their due dates.
And all of these things can have really big impacts on, decreasing the risk of having breech babies and things like that, because there's more space. We've got a lot of people who have scoliosis or those C or S curves through their spines, and they end up getting to 36, 37, 38 weeks and their babies still breech. And it's amazing how even just addressing all of those sort of postural things allows bub to turn naturally. So we don't spin babies, but we can help the body naturally help your baby spin.
Or prevent,
things like that. And even just think about all the heads that get stuck, shoulder dystonia, all those things are usually due to the position of the pelvis. So even myself, in my birth, I am a naturally really tight person, and I was getting regular osteo treatment in my third trimester, like weekly, and my bub still got stuck. I mean, he was a big boy, but he still got stuck at everything like that. So Chris was amazing throughout my labour, trying to get me into certain positions, and I'm actually amazed I didn't have to go for an emergency cesarean. I'm super fortunate that I got to have a vaginal delivery, and I think a lot of that came down to knowing those positions for birth, Chris knowing how to help offload areas of my pelvis and put me in certain positions. So it's a massive impact.
Yeah. Isn't it amazing? And on breech babies too, I truly believe in my soul that if your baby is breech, there's a reason for it. Either because of the umbilical cord or because of space or tightness in the body, whatever it might be. I'm not saying baby will always turn. I'm not saying that at all. But there's a reason why they're in that breech position. And so I imagine osteopathy and treatments can just help create space if that's the reason why your baby's breech, so that it can facilitate that turn if that's what they need to do before birth.
Yeah. And that's a huge, a part of osteo is that we're not really fixing people. We're just facilitating the body to do what it's meant to do and heal itself. So it's like birth. Our bodies are made to birth babies. Like, it's a physiological process that our body is made to do. So if we can help get that body to an optimal state, we're helping the body be able to
do what it needs to do.
Yeah.
I always like the analogy. I remember my midwife, when I was a bit nervous leading into birth.
Yeah.
She said, a woman in a coma will still have her baby.
Yes.
Yes. Oh my God, the body knows what it's doing.
Yeah.
So all we're doing is, like Chelsea said, is assisting the body to actually just do what it needs to do optimally.
Yeah, it's so true. So true. I've heard that as well, is that a woman has given birth in a coma. And that just was mind-blowing to me, how amazing our bodies are in doing what they need to do. And just lastly on that, in terms of preparing for birth. What about positioning of baby? Can osteopathy help with that? I mean, you mentioned creating space, but can you go into that into a bit more depth?
I guess we sort of already covered that in the way of we're sort of working on the vessel that baby's in. So whether that's ribs, spinal position, pelvic position, particularly if baby's breech, posterior, it's all just about allowing that space. And that doesn't even come from the vessel, but also just how all that fascia, muscular tension and everything all relates as well.
Yeah. Like to give an example, like if we have someone with a really severe scoliosis and they'll be sort of compressed through one side. So if they're really tight through this side between their ribs and their pelvis, that bony structures, there's only this side or the other side of the tummy for the baby to kind of sit, and it can't move around as well in the tummy. So facilitating with opening up that stuck side can help give them more space, all that.
And then positioning as well, doing things at home. So take home exercises, like
That's
even on all
thing.
fours and letting bub hang literally in like your skin and your fascia, and just let that uterus actually have the space to go with gravity and allow baby to shift. But like you're saying, we don't spin babies, but we can definitely help your body be in an optimal position for baby to spin or move or descend.
Yeah, and exercises can be a great thing. Like there's another example that, back in the day when we didn't have so much technology, we used to have to wash the clothes ourselves and do all of that stuff. Women were moving around and cooking and feeding other kids, or were moving around, whereas nowadays a lot of women have desk jobs and they can work all the way up to right till the end. So they're sitting, there's a lot more sitting, and that tucking and compression of the pelvis can often is maybe why that they're seeing more breech babies, or babies getting stuck and that sort of thing, because we're not as fluid and moving as maybe we could be if we have those types of jobs.
I even just span my chair around in my last trimester, and I sat like straddling the back of the chair, and that naturally gives you more of that anterior or like forward tilt of the pelvis, which opens up and gives bub more space to sit rather than sitting and like slouching. So even little things like that, if you're sitting at your desk all day, can make a massive impact in that last trimester.
Totally. I remember I read a book in my second pregnancy about how important posture was. And so, because I have a desk job, and so every day I'd be leaning forward and sort of trying to really focus on just being upright and my posture to allow room for baby. Because like you said, having a desk job, I'm doing it now. I'm just slouching back in the chair and my my back is arching, like all of these things. And I love that you give take home advice and education and even exercises to do for women in pregnancy at home to help with all of this sort of stuff. Yeah, it's great.
We also have clinical Pilates here. So Chelsea and I are both clinical Pilates instructors as well. So we love getting women in there and working on their flexibility and strength and everything too. So it's really nice to be able to go through exercises and things as well.
Yeah, I love that. So moving on to postpartum, how soon after birth, whether it's a vaginal birth or a cesarean or even instrumental delivery, is it recommended for women to come and seek treatment from an osteopath? And how can it aid in postpartum recovery?
I would usually say as soon as you feel ready. I know there's sort of that 6-week time frame that a lot of practitioners might use, but I think the things that we can do help assist the body in healing. So I think as soon as you feel ready to come in and seek treatment, I think is what I would give to patients. Whether that's 2 weeks after or 10 weeks after.
And even if you've got pain through your coccyx after birth and you're not quite ready to be like touched in that area, there's still so much we can do up the chain to help take the load off the coccyx, even though we're not touching it. So don't be like, oh my God, I'm not ready to be touching that. Like come in at any time. I mean, Chris was treating me in the hospital 2 days after giving birth. So there's no real time that's too soon. I mean, obviously we won't be going and doing heaps around scars after C-sections and going in around episiotomies or anything like that. But there's still things we can do around the area for sure. And this, again, the sooner the better, I believe, but you have to feel ready.
Yeah, and if you're not ready for hands-on treatment, just coming in, having a chat, talk about your experience if you're ready for it. We can give you just a few self-release or self-exercises that you can do at home. We don't have to start hands-on straight away if that's not what you feel ready for, and then we can treat up the neck and shoulders, and we don't have to go anywhere you don't feel comfortable if you're not ready until you feel ready for it.
I even had a client who I was working with, obviously leading up to her birth, and I was talking to her about postpartum, and she was just like, "Nah, I can't handle anything postpartum yet. I'll just come in a week after I give birth, and even if you just tell me what to do, great." And I was like, "Perfect. If that's what you want to do, awesome. I'll see you in a
Yeah.
week."
I love that. And I love that you say when you're ready, but also no time is too soon. Because I think we have that 6 week time frame in our minds so much. And the thing is, when you reach that 6 weeks, most of the healing process has already sort of happened. And undoing all of that just adds more time and energy. And I guess women can experience pain for longer, you know? Whereas the sooner you get in to receive these treatments where the body is facilitated to heal on its own, you're going to have a faster recovery. You're less likely to experience pain. And you're already heading towards a nourishing postpartum period, which is what every woman deserves, right?
Big time.
So I love that you've set no time limit, and it's really, whenever a woman is ready.
Yeah. And there's also all the other things that people get postpartum that isn't even related to their birth, like nursing, not sleeping very well, having to crouch over a baby's crib. Like there's so many different complaints that we see that aren't even related to birth. So yeah, it doesn't even have to be like a birth related treatment.
Yeah. And on that too, even with breastfeeding, like I had a breastfeeding pillow, but I have quite a long torso. And so my back was still hunched. And in those early days, you could be sitting there feeding for, I think I had low milk supply. This is just my own example. And so it would take an hour and a half of a feeding session. And then I would probably have half an hour break, and then I'd be back to feeding again. So there was no like, it was
Things like that.
Yep.
so all that sort of stuff. I'm such an advocate for women getting these sorts of treatments to facilitate the natural healing process and not experiencing pain or limiting it.
That's it. And even just knowing that those things are normal and can be helped, because some people
Yes.
can get a lot of stress around that when they're feeding and they're so focused on baby, which is amazing, but also you are just as important. And, if you're stressed and you're uncomfortable, your milk supply might not be as optimal as it could be. So you really do have to take care of you too. And getting out of the house and seeing an osteo and also just talking about your experience is treatment in itself, because you do need to get out of the house a little bit too.
Yes, totally. So how does osteopathy support new mothers in regaining strength and balance after birth?
So some common like postpartum conditions or issues that we deal with, it might not even be related to the pelvis and birth. Like later down the track, like you said, feeding is a huge issue. So many women come in at that later stage and they've suddenly got a shoulder issue or a neck complaint from feeding postures, even like picking up the baby, carrying the baby. Like you're still in that recovery process, but you have to do so much of that manual physical work
And you're
as
sleep
well.
deprived.
Sleep deprived. So there's lots of things that we can help with that. So it might even be, showing you how to pick up your baby. So something like we probably all just tend to pick them up and lift them up towards your chest like that, but we could bring them, kneel down, bring them closer to your body and use your legs to stand up, even like getting in and out of a chair, things like that. We can just give you little cues or tips to help do that in a better way that is not going to put so much strain through your body. So again, like helping with the recovery and preventing those musculoskeletal issues from coming up.
Yeah, I love that. And I love that you gave that example too of picking up your baby, because obviously we do that a lot. And can you explain the importance of integrating osteopathy with other postpartum sort of practices and treatments like physical therapy, could be physiotherapy, nutrition, even mental health support? How can osteopathy integrate with all of those aspects?
Yeah, so I guess, like we sort of said before, we've got a real plethora of options we can refer you to. And most osteopaths will have a couple of connections that they really know and trust. So whether it is psychologists, naturopaths, dietitians, or physios, we do a lot of clinical Pilates whenever the client is ready for that. But The lactation consultant as well is another massive one.
Yes.
Yes. Yeah.
That's one of my key recommendations for
I recommend
postpartum.
everyone books in with a lactation consultant for a first-time feeder, regardless of how good you think you're breastfeeding, because
Yes.
there is so much to know. I mean, like having a baby is huge. There's so much you need to know and trial and learn from. And this is different baby to baby too. But yeah, lactation consultant is massive. So yeah, we work with a lactation consultant up here and she is amazing.
Mm-hmm.
And even just identifying things like tongue ties might not even be you. And how you're feeding, you could be doing everything right, but your baby has a tongue tie and isn't latching. So there's definitely things that we can help in that sense, as well as referring. And yeah, I mean, like you said, it's holistic. Everyone works together. No one's going to be able to solve everything, and it is a matter of just reaching out and asking for help.
Mm-hmm.
Yes, we need to do more of that. Stop. Women need to stop trying to think that they're responsible for everything.
We are superwomen, but we're not superwomen.
Yeah. Ask for help.
Yeah.
That's number one message, is ask for help.
Mm.
So let's talk about what to expect in a session. So for someone who is considering osteopathy for the first time, what advice would you give them and what can they expect during that initial consultation?
Yeah, so normally in our initial consultation, we'll start like just getting to know each other and asking lots of questions. So we'll go through a case history. So in terms of if it is more of a pregnancy related case, we will go through like your general health as well, how you've been feeling in your pregnancy so far, your journey leading up to it, like whether you've had if this is your first pregnancy or whether you've had previous pregnancies, and what was your birth like, did we have intervention, any complications through those processes. So that's sort of some questions we'll start to ask, and then diving in if they've got some pain in a certain area, or a particular area that they want help with. Or some patients just come in and they don't have any pain or anything wrong, and they just want to start that journey of support and that prevention and maintenance, which is what we love as well. So we'll start off with that. We'll go through a case history. There's also no pressure to talk some things that patients aren't ready to divulge in that first session as well, so that's totally okay. We will just talk about what you feel comfortable with. Then we will often get into an assessment. So we'll do a full body assessment. We look at everything from head to toe, how you're moving, some like functional movements, like see how you get in and out of a chair or bending down to pick something up from the floor. So it's very functional in that movement as well. We might look a little bit more into a particular area. If you've come in, say, with back pain, we'll have a look at how the pelvis is moving. But we generally will look at the whole body anyway, and then we'll get into some treatment, and then the end of the session we'll finish off with maybe an exercise or two to take home. We'll like through the treatment we'll often like have a bit of a chat as well, and we might chat about some little lifestyle things that you can implement, and there's always time for questions at the end. And we'll set up a bit of a management plan going forward as well, in terms of like how often we think you need treatment, how long we think you might need treatment for, and work with the goals of that patient as well.
Yeah. And I love that you mentioned that it's sort of like an ongoing thing too, where you need a treatment plan, because I think a lot of people just want this quick fix, or they just want one treatment then to be able to walk away. But really it's to get the body aligned and to facilitate this healing process. It requires a treatment plan. There is no one-stop shop quick fix. It just doesn't exist. And even if it does, it's not long-term.
Yeah.
So I love that you mentioned that. So to wrap things up, what advice do you have to offer expecting and new mothers regarding pregnancy, birth, or postpartum? Just general advice.
I would say just get a really good support team around you, whether that's friends and family, but then your healthcare practitioners as well. So whether it's your osteo, acupuncture, nutritionist, midwives, GPs, find the people that you align with as well and that you feel comfortable with. We all treat slightly differently as well. So if one person doesn't really work for you, you can find someone else. But support, put yourself first.
Yes, we're so bad at that.
Yeah.
Mine would be to trust your gut. No one knows you or your body as well as you do. And we do have those intuitions when sometimes we think something might not be quite right. And even if it's totally fine, we're going to stress about it and suffer in silence until we go and get that verification that everything's okay. So don't wait, just ask. Call your midwife, talk to your partner, go see an osteo, go to your GP, go to the hospital, whatever you need to do, because there's nothing worse than sitting there and worrying. It's not good for you, it's not good for baby. And to speak up and ask for help. Ask for help. I am shocking at asking for help, and I have learned that I actually have to, or I burn out. So
Yeah.
do it. If anyone offers help, take it. And don't take it and then clean the cupboards. Take it and go and see your osteo.
Yeah.
Yeah. I love that advice because we're so conditioned, particularly as women, from a really young age, not to ask for help and to do everything ourselves. And so it is so important. We've got to let go of that. We've got to let go. And we need to trust our gut too, like you said. We need to tune back into our bodies because this conditioning happens from a super young age that someone knows our body better than we do. And we just need to bring it back to that. And I love that you said that. And I love what you said too, Chelsea, about if a treatment or a person isn't aligning with you, go find someone else. Don't give up. Don't just be like, oh, maybe even osteopathy isn't for me.
Yeah.
Find a different clinician. Keep searching, keep going, keep trying to find that person that aligns with you. Do not settle. Don't settle.
Yeah, and find your village. I actually heard on a podcast recently that they were talked about, like, even if you see like seeing a psychologist, there's actually evidence now that people get the best outcomes if they have a good relationship with their practitioner, no matter what the treatment they use. Even osteo with the hands-on treatment, doesn't matter how good that treatment approach is. If you don't align with that practitioner, you're probably not going to get the best results as well. And I find I get the best results with patients that I really get along well with and we connect and we're on the same page. So yeah, there's so many people out there. Find your person. And
I love that. So I love this conversation so much, and there's so many questions I want to ask, but I do have to wrap it up. So for listeners who want to get in touch with you and learn more about your offerings, how can they reach you?
So obviously our website, osteosofnoosa.com.au, but feel free to email us, give us a buzz, message us on Instagram, Osteos of Noosa. We love talking all this stuff. So if anyone has any, even if you're not from Noosa, like anywhere, feel free to send us a message and reach out. And obviously if you're in the area, we'd love to meet you and help you. But yeah.
Oh, I love that. So I'll link everything in the show notes too for people who want to get in touch.
Yeah, perfect.
Well, thank you so much, Mandy and Chelsea, for coming on. I've loved this conversation so much, and I'm so glad that we made this time to have this conversation because you've just offered such knowledge and wisdom to the listeners, and it's been great.
Thank you so much. And thank you so much for you taking your time out to do this for everyone out there who needs this sort of stuff.
Oh, thank you. Appreciate that. Thank you for listening to this week's episode of the Mama Village podcast. Check out the show notes for a link to the Mama Village Instagram page where I upload pregnancy, birth, postpartum and motherhood resources. Please let me know what you think of today's show and what you would like to hear from the podcast by leaving a rating and review. If you like the show, please subscribe and leave a review on your podcast platform. If you would like to share your positive pregnancy, birth, postpartum and motherhood story, or if you have education in the space to share, please send me a direct message on Instagram or email the.mamavillage@outlook.com. For all my listeners out there, thank you for your continuing support, and I will speak to you all in next week's episode.